The next question is the chat is what to do if you go into a home, your new BCBA, and the therapist and the parents are comfortable with how the sessions have been, which has been in the client's bed. And she is 11 years old, and you'd like to move working from the bed to a table for some of the goals. I would look at, is this a cultural bias, or is this something that is okay from the family's perspective? Maybe have that conversation with parents before making any changes. Trying to understand, like go to the parents and don't say this is my goal, this is why this is my goal, and this is why I'm going to prove that I'm right. But asking them, why do they prefer that this is the case? Like, you are new to the team, so maybe there's a reason, or maybe there's some explanation. And hearing them out, and then seeing if there's an opportunity for you to explain to them why you think it's important to move it to a table, and see how that goes. But it's very hard to come in. I know, like, I've, come into new teams and wanted to make changes because, like, everything they were doing before was wrong. And not that that's the case, but like sometimes it could just feel very aversive to parents when the new person is coming in and like changing everything right off the bat. So taking that into consideration as the new person, and being sensitive to like not making all these drastic changes all at once, and seeing what you could do.
Yeah, absolutely. I agree with that. There's certain times where I just want to do like a sweeping change and say, okay, this is it. But you can't. I always joke around about, you're shaping, if we talk about shaping students, right? Well, you're shaping behavior of parents and you're shaping behavior of your team just as much as you're shaping the students. So going in and making small changes at the first. Yeah, it sounds like she goes to school, so they're okay with her laying in her bed and relaxing during therapy. You can also explain to the parents, once you talk to them and say, listen, like, is this a goal? If it's not a goal, then really you can't touch it. But you can explain to the therapist, to the parents, that she's 11, she's only getting older. So if you're doing therapy in her bed and she's hit puberty, like, I'm not sure if that's even appropriate, whether that's even, male, female staff. I don't know if that's appropriate. That you may say, listen, can we do it in a beanbag chair instead? If you wanted to relax during therapy, can we get something else other than her bed? There may not be room in her bedroom, or there may not be room in the apartment, etc., for a beanbag chair. You've got to take that into consideration as well. But if there is, looking at something else she can relax in besides her bed. Great.